from the Psych Hub Podcast Network.
Hi, I'm Marjorie Morrison.
And this is Patrick Kennedy.
And you are listening to the Psych Hub Podcast, The Future of Mental Health.
Today, we're really honored. We have Dr. Patrice Harris. Dr. Harris has been a real champion and hero for all of us. But over and above that, and we'll talk about it today in our podcast, she really appreciates the kind of systemic approach to getting the best outcomes from our health system / mental health system, provided we do the right integration, not just in mental health into healthcare, but integration of a whole lot of different other systems, from education to justice to housing, into our overall approach to seeking better health for all Americans.
And I just will give us a little bit of background on her before we dig in. Dr. Patrice Harris is the co-founder and CEO of eMed, which combines the most authoritative and inexpensive in-home test kits with the largest real-time network of certified remote proctors. I've actually used it before. It's really cool how it works. She's board certified in psychiatry and has diverse experience as a private practicing physician, public health director, and patient advocate. In 2018, Dr. Harris was elected as the 174th president of the American Medical Association and the first African-American woman to ever hold that role. And now to our conversation with Dr. Harris.
So, Dr. Harris, it's really great to see you again. I'm obviously a great fan of all you've done as president of the American Medical Association, and specifically because you're a leader in the mental health world. And boy, we need the House of Medicine to really understand the value and importance of integrating mental health. And having you at that important place as president of the American Medical Association is so vital for the House of Medicine to finally understand how valuable mental health is in their actually achieving what their goal is, and the betterment and healthcare of our country, which just cannot be done if mental health isn't fully integrated. And you are the one that helped bring that message at a critical time to all of your medical colleagues. And we're really just so honored that you're able to join us today.
Well, thank you, Patrick. The honor is mine. And of course, I admire all of your work and advocacy over the years. And I think you recall the night of my inauguration. It seems so many lifetimes ago, but it was June of 2019. And I said I wanted to elevate the importance of mental health into overall healthcare. And I have to tell you that really over my last 30 years or so in leadership in organized medicine and at the AMA, we've come a long way. If you look at a lot of the policies of the AMA, mental health is front and center. So happy to be on with you today, and I'm looking forward to the conversation.
So do you feel, Dr. Harris, that you've made an impact in that huge goal of trying to integrate mental health into overall health? I mean, that's kind of one of the biggest things that we think about every day, right? And how we use and think about mental health is just part of our overall well-being.
Well, certainly using the platform is one piece of it, right? And just elevating the conversation. And just speaking about AMA to start, if you look at our policy and if you look at our recent work, we have an entire initiative on integrating mental health into overall healthcare, specifically primary care. But that's the policy piece. And as you know, Marjorie, policy is just the first step. Executing policy, funding for execution of that policy is always critical. And that's going to require an all of society effort and commitment, and a sustained commitment. I know that we are all very glad that President Biden sort of amplified and elevated the importance of mental health. And, there's funding in the budget for mental health. And I think the good news, and Patrick can tell me if he believes otherwise, is that the good news is this is bipartisan, right? As far as I can tell, although listen, there's always going to be a little bit of politics, but the effort and the commitment to the effort is bipartisan. And so I do think that I won't take all the credit, but I think it's the entire community of advocates, of people who've been working for decades and people that are working now are making an impact.
This really has been a bipartisan effort, and for us to do anything in America effectively today, it has to be bipartisan. We're very honored at PsyCub. We have the support of Senator Frist, and he's been a terrific help and an asset to us. And as you know, we also have enjoyed a great deal of support from all of our friends on the Democratic side as well. In Atlanta, where you are, I can tell you there's been no greater champion for mental health in this country than David Satcher, our former Surgeon General, who was the first Surgeon General to author a mental health report as Surgeon General. And that has made a big difference over the years because he has really pioneered the notion that mental health is not just the clinical care, but it's also the importance of incorporating the social determinants of health, which, as you know, up until very recently, people did not really appreciate how much success we can have in helping people achieve best outcomes in mental health if we don't make sure they're first not safe with their stable housing, if they're not food secure, if they don't have access to employment, if they're suffering from trauma, poverty, and the like. So I'd like to ask you just to talk a little bit about that other new frontier. First, it's incorporating mental health, but then it's incorporating social determinants of health as part of both mental health, but also part of overall health care. Can you talk a little bit about that?
I can, but let me also say, I still feel so fortunate to live in Atlanta for all these years and be able to run into Dr. Satcher on several occasions. And that was wonderful. That report, it was just groundbreaking because, again, I think that you and Marjorie and I know that although we have come a long way, it's still difficult to talk about mental health. And of course, remember that when he published that report, we were nowhere near where we are today. Clearly no one would have wished this pandemic on our world. Of course not. But there have been some opportunities to learn. I always say some learning moments. Now, the question, and candidly, I say the answer is still to be determined, is whether we will learn those lessons and whether we will have this sustained commitment to thinking about that. But clearly, of course, the lack of a public health infrastructure. I think people for the first time or realizing the interconnectedness of what you call the social determinants, the social drivers of health. When I give a presentation, I show this slide, and it really sort of lays out all of the social drivers and how they are so interconnected. Housing, the built environment, and if you really want to just break it down to COVID, is we're thinking about the built environment and ventilation systems, and we hadn't thought about that with airborne disease. So the built environment, whether or not you live in a food desert, if you have transportation, if you live in a community where perhaps from redlining that occurred decades ago, from building an interstate highway system through communities that subsequently resulted in decreased property values, and how do we fund our education system through property taxes? So I think, again, one learning moment that we can't miss, and I think has been elevated, is just the interconnected of these social drivers of health. And just like, as you know, we can't have good overall health without good mental health. We can't have good overall health unless we begin to address some of these social drivers of health.
Well said. I wonder if you could describe a little bit this slide, like to listeners that couldn't see it with some detail.
So let me just say, it's not my original slide. I borrowed it. There's a group out of the Bay Area, and they call it the Bay Area Framework for Health. But they just show all of the pieces of our community, our society that impact health. And so you do see an icon for housing. You see an icon for past discriminatory behavior. You see an outline talking about transportation, access to fresh food, air quality, water quality. You see the individual and the family in the center, and you see all the drivers around that. And that, to me, demonstrates the importance of us always keeping the family and the individual at the center of our work, and making sure that all of the other pieces work towards keeping the family and the individual at the center and the focus of our work.
I love that.
Dr. Harris, with the COVID crisis, we're getting an idea that this has to be a public health approach. We're finally realizing we're all in it together. We have to have good surveillance. We have to know where the COVID outbreaks are. We have to know what environment we're living in so we know the risk level. We have to get our inoculations. We have to try to make sure that we're protected so that we don't transmit a COVID. That's a paradigm that actually applies with mental health. We have to get out of this thinking that it's just a singular issue with a singular patient with a singular diagnosis. It's really affected by the environment. We're talking about the social environment, the physical environment. And so I really like the fact that you've talked about systems, but to your point, we not only have systems that fragment mental health from physical health, but we have systems that fragment addiction from mental health and physical health. And we even have systems that do not treat people with intellectual disabilities for their mental health and addictions because they figure, oh, they're taken care of in the IDD box. We don't have to worry about people with autism having anxiety and getting treated for anxiety because they're already caught up in a system over here that we're thinking that they are taken care of. And yet, even that is detached from our education system, which has got such a fundamental role to play, to your point on a social emotional learning and neuroliteracy. That's been detached. And of course, we're detached from the housing system, which, as you know, people with mental illness, if they just get a safe place to reside, their ability to benefit from the kind of clinical care that you as a psychiatrist can give, it is outstanding, but they can't benefit from either medications or your clinical care if they don't have a safe place to live. So I really hope you kind of help us think that the future system we want is integrating health, human services, education, housing services, job training services in a much bigger systems approach, because that's the solution. It's not, I'd love to say it's all of these individual programs, but if we can't align the big systems to collaborate, we're never going to get people the kind of 360 approach that we need to get them in order for them to thrive physically, like we were learning with COVID, but to thrive mentally as well.
Patrick, that's spot on. And I can tell you I'm so excited. Actually, I've been fortunate to be placed in situations where I can make a difference, which is the reason I wanted to go into medical school in the first place, and just, worked really hard, of course, and, had a lot of opportunities. And when I was health director in Fulton County, Georgia, we looked internally at how we were providing services and even working together. And of course, we, like everyone else, this was not unique to us, we're working in our silos. But what's important about that is we didn't say, oh, well, we're working in our silos and oh, well. We said, all right, what can we do about it? Because that's always my thing. All right, once we know some data, my grandmother used to say, if you know better, you should do better. And so we said, all right, what can we do? And so we decided that, as a county, and even we used to have a director of health, public health, and a director of behavioral health. And so then we said, no, let's have one director. The departments are going to stay the same, but one director. Of course, I had that position. And then we were going to say, listen, we provide housing. We provide employment. We had an employment team. We even took our libraries. So we sort of formed this health and human services agency. And, sometimes it's the building and sometimes it's not, but we were able to, with no new tax dollars, by the way, build a brand new system where we had, we didn't offer, of course, primary care, but we had a primary care partner, behavioral health and public health, all working together, all in the same, down 2 hallways in the back. Our premise was if we could get a warm handoff, because I can't tell you, Patrick, how many of my primary care colleagues said, and how our system is, and we've sort of reduced down to these 15-minute visits. And I can't tell you how many of my primary care colleagues will say they're working, patients come in and they go through all the things. And at the very end of the visit, and they say, oh, doc, I'm having these thoughts. Maybe I don't want to live anymore. And then what, right? And so there wasn't a system for them to do that. So that gets to that integration, which we are early on, but we do have some data about the collaborative care model. But not only did we have primary care, behavioral health, we had our housing team in the same building, our employment team in the same building. We had a drop-in daycare that if you came for services or one of your children came for services and you had to bring your other two, there was a drop-in daycare for them. Look, there's no one-size-fits-all approach here. But the general model is to make sure that there's coordination of these services, not only what we consider traditional health services, but also these other services for the social drivers of health.
Well, Dr. Harris, I just want to state right now, you're my choice for the first mental health czar in this country's history. I'm just telling you, I've already spoken to the White House. I told them the other day because I knew of your work. I've known you for a while. You get it. You get the systems approach. And the czar would have to coordinate amongst the cabinet. How do we integrate all of these federal agencies to a common agenda? So in other words, we have to paint the picture for the federal government, for the American people, for the Congress. How is it going to be that we get to the system we need, which is totally 360? And the only way we do that is if everyone in the administration is pulling towards the same goal, so that the Secretary of Housing understands what their role is in achieving the system. The Department of Education, Secretary Cardona, knows the role. That the Secretary of Health and Human Services, Javier Becerra, knows the role. That those that are doing criminal justice know the role, because if we can align each of their budgets to that common goal, we get so much bigger bang for our buck. And I love the fact that you mentioned you don't have to raise new resources to do this. If we just reappropriate the resources we already have, which, by the way, are really squandered, trying to pick people up out of the street, who are stuck in emergency rooms like Grady down there, or all across this country, who are housed in our jails and prisons to the cost of hundreds of billions of dollars a year. We could literally get people stabilized, treated, and back in the workforce and in their communities in a way that we're failing to do today. I'm sorry I put you on the spot by telling you that, but you have been president of the American Medical Association, so the medical community, you've got that understanding. You've been in child and adolescent psychiatry, and the mental health community thinks the world of you. What you've done in public health is unsurpassed. So you really get all of these dimensions, and that's what we'll need in a good mental health czar. But whether or not you get it, I'm just telling you, I'm already your biggest champion for that job. And not like you'd want it right now. You're out in the private sector, but you're a person who's committed your life to helping others, not making money. And Lord knows you wouldn't have gotten into psychiatry if it was about making money, because you could have gone in any other field of medicine and made 3 or 4 times what you've made as a psychiatrist. So sorry for just being such a fan, but I want to tell all the listeners what a champ you are.
Well, I will tell you that I very much appreciate that. Just a funny, quick story about when I first told my mother that I wanted to be a physician. And a mother often knows her child very well. So she said, "Oh no," and she was joking, although I think she was half joking. She said, "Oh no, you're never going to make any money because you're going to accept chickens for payment." So
I love it,
Patrick. But to me, you're right. It's been about the work, and I just feel strongly about these systems. Just quickly, another group I've been working with in Atlanta, the Archie group, Atlanta Regional Collaborative on Health Improvement. And we have, and I know we're podcasting, can't see, but we developed another graphic where we said, listen, what we need to work on, again, writ large, is our helping to what we call invert the burden. As you know, systems and people have to often navigate through multiple systems. And we need to, as a collective, figure out a way to invert the burden and make the systems easier to navigate. We need to do all the work and not expect the people who need services to navigate through the labyrinth of systems out there.
Marjorie,
I was going to say
please.
this is the most quiet I think I've ever been in a podcast interview, but you guys were just going on this, and I didn't want to interrupt. Not to pivot and change the subject, but I would love to hear about the work you're doing now at eMeds. Maybe share with us what inspired you to go there, and the work you're doing there, and the work you want to continue doing.
Absolutely. And let me say the commitment to service was the reason that I went to eMed. And we haven't talked today and we don't have time, but Patrick and I, Marjorie, that technology is going to be and can be and will be a good opportunity for us to address some of the issues around access to care and quality care. But we have to be careful, nothing is a panacea. And so sometimes I hear people just saying, oh, if we just do this, it's a panacea. Nothing is a panacea. And there should always be that continuum of care. But as president of the American Medical Association, at the very beginning of the pandemic, I was so frustrated with the lack of equitable access to testing, right? We didn't have a lot of testing. We were behind a lot of issues about, again, preparedness. And Patrick, I think we should always be in a mindset of preparedness for public health and mental health and all this, so preparedness. But what tests there were, they ended up not being in the communities that we saw at the very beginning were disproportionately impacted. And so I was contacted by a group of investors and some other engineers, very smart folks, and they said, hey, we're thinking about this, and we've heard you speak about it, and you have expertise here and looking at equitable access to care. Would you like to join us and start to think about this? And long story short, I came on board and we started to think about what we could do. And we were thinking about COVID, but we were also thinking about the long term, because again, COVID accelerated the adoption of virtual care and digital care. And so we'll have to tease all that out as we get on the other side, regulation, laws, all that. By the way, I'm a firm believer in not just saying, yeah, let's do this, but let's have some evidence and support. But yeah, so I went and they said, listen, a lot of great ideas. Would you like to lead, with your ideas and co-founder? So a co-founder and CEO. And our first foray was with a partnership with Abbott Labs, and they had the Binex Now test. And of course, these tests, they used to be in 40 packs and they were meant for hospital or clinic settings. And we said, wouldn't it be great? Wouldn't we be able to increase access to these tests if people could do it at home, but do it in a way that was verified and validated and felt good about the specimen collection? And we developed a platform, went to the FDA to get the EUA, and we've been, our business has evolved. We at first we were like test to know, people wanted to know, and then test to go. Our test is used a lot by the traveling community, particularly those coming back. And now test to treat. We have these 2 new oral medications. We've had other treatments that we want to make sure that people get, right? You got to get that in the first 5 days. And so we have a solution, again, not the solution, not one solution, a solution for rapid access to this testing, and so that people can get the further care that they need. So I'm very excited, and we're thinking a lot about the future and what can we do next. I always say it's 2 things we should make in healthcare. We should make the right thing to do, the easy thing to do. I say that a lot. And I also say that we should make sure that there's equitable access to care, doing all that we can for earlier diagnosis, which would lead to better health outcomes, both on an individual level and a population health level.
So, a couple ideas. We worked closely with Abbott on the blood test for proteins in the blood following a concussion. And Abbott bought the intellectual property from a study, traumatic brain injury, longitudinal study that showed that there are ways to screen for that very difficult thing to do when someone's had a traumatic brain injury, to determine what kind of injury it is. And the current CAT scan really doesn't capture the injury to the brain. You just can't see it. But, a blood test can tell whether there was a puncture of the blood-brain barrier, which is the key aspect in determining what type of concussion it was and whether it needs that necessary follow-up. And given the fact concussion is quite normal in everyone's life, unfortunately, in this country, it has such a profound impact on mental health if you don't get it treated right. Perhaps you should talk to the Abbott folks about whether they could also do something on a concussion test through this new blood-brain
Patrick, you're
test
giving
that
away
they can
like
do.
trade secrets here. You don't want to be like, giving them what's.
I know, but this is, people need to know, because they don't go to the ERs. They think, oh, I'll be fine. Or they go in their sports team and they shake it off. And as we know, that's not true. And if they don't get the attention they need early, the effect of an inadequate response can really harm them over the long haul. And so I'm thinking, for people who thinks they can just man up and not do the test because it takes too long, or that CAT scan or what have you, maybe doing it online with that Abbott blood test would be a good additional thing that you might incorporate down the line.
Well, thanks for that. But you know what? I think the key, early. And we know this with schizophrenia, bipolar disorder, depression. The earlier we get someone their adequate diagnosis and get them on treatment, the better their long-term prognosis is. So I'm so excited about the future and the use of technology, for early diagnosis in infectious disease. You talk about traumatic brain injury. I think that there's so many opportunities. We just have to make sure that we're evaluating these and there's evidence-based, and that we make sure these new technologies don't worsen health inequities. But that's the reason I got involved, is I wanted to be in on the ground floor, and just so very excited. So thank you for asking.
You're doing great work. I mean, there's so much work to be done. And I hate to interrupt Patrick when he gets on these very passionate roles, but I think, I honestly think he's one of the smartest people in this space and knows it so well. And so I know when he gets excited, there's really good reason, because when he says he wants you to be the mental health czar, that's like the greatest compliment that one could get from him. And I just thank you so much for all that you've been doing and continue to do, because, not that we need this now more than ever. We always have needed it, but there's a time now that we can really make an impact where people are paying attention, and it's hard to know how long we'll have that time. And right now people are focused on mental health. So it's like we all have to kind of break some glass and try to get some things done that in the past we couldn't.
Couldn't agree more.
Thanks again, Dr. Harris. We really have enjoyed having you on, and look forward to all the work we all can do together going forward.
Thank you. It was my pleasure.
As always, thank you for listening to our podcast.
If you enjoyed the show, drop us a review.
If you haven't already, subscribe to our podcast for the latest episodes.
For the latest insights, check us out at psychhub.com.